Immoral, heinous, and sinful are often used to describe people living with HIV/AIDS in Indonesia. As a country that upholds substantial religious values, they face a resolute negative view. The moral burden, stigmatization, and discrimination that they face become major hurdles for people to get tested. If people don't get tested, they won't receive any treatment at all, let alone adequate treatment. This is why in 2020, Indonesia recorded 24,000 AIDS-related deaths. That is a 100% surge from 12,000 in 2010. This is why Indonesia is the fastest growing HIV epidemic in the world. The Indonesian Ministry of Health in 2021 reported that there are 7.9% people living with HIV/AIDS age 50 and above. They experience higher risk of comorbid diseases, which resulted in higher mortality rates, ranging from 1.7 to 7 times higher compared to their uninfected counterparts. So I believe that we can clearly see how devastatingly impactful stigma is in Indonesia. But, and this is a big but, what if we can find a traditional knowledge that can create a utopia or a safe haven for people living with HIV/AIDS? And we found one. The traditional knowledge can be found in Sasak, Indigenous community in Lombok. So naturally, we explored and delved deeper into this precious traditional knowledge. We conducted a preliminary qualitative study in Sikur, East Lombok, Indonesia, by doing case study, in-depth interview, and focus group discussion with the locals, ranging from community leaders, healthcare workers, people with HIV/AIDS themselves, and also just the ordinary local community member. And what we found was astounding. Besiru derived from the word siru, which in local dialect means mutual, manifests in mutual understanding and mutual respect among community members. When traced in this community, there were 23 phrases of Besiru. In some other community in other part of Lombok, they even have more. But all of those phrases echo the same humanistic values: mutual respect, mutual understanding, and mutual cooperation among community members, and to treat the community members as one big family. We found there were 16 relevant phrases of Besiru, like saling tulu, which means to help each other as servants of God, saling asa, asu, and asi, which literally translated to lead, to remind, and to take care your community, rai, which means to empathize, and saling ajenang, which means to mutually respect one another. After conducting in-depth interview and focus group discussion, we identified 3 major themes. The first one is the knowledge, the second one is stigma, and the third one is compliance and community engagement. The knowledge. Generally, each member of this community, they have proper knowledge regarding Besiru. They might not know all of the phrases of Besiru, or they might not know verbatim what are the phrases of Besiru themselves, but they understand what are the essences of Besiru. And the second one is stigma. We interviewed and conducted focus group discussion with people living with HIV/AIDS. There was one shocking answer. This person, nobody had any idea about their HIV status, but in their own words, they said that had people known about their HIV status, they believed that they wouldn't have reacted differently and they wouldn't have discriminated against this person. And this person would still be very safe in this community. When other community members asked about stigma, they had the same idea that to discriminate against other people is actually against the will of God and is actually a sin. So this is actually quite surprising. The third one is compliance and community engagement. One of the health workers told us that they have seen higher compliance and higher adherence to treatment from patients in this community compared to other patients from other communities. And they saw the community leaders were very engaging in the VCT program, and the community members were very enthusiastic when it comes to HIV education outreach programs. In conclusion, we believe that the phrases of Bisiru are deeply ingrained in the community, creating a cultural harmony among the community members, and this community is essentially a safe haven for people living with HIV/AIDS. We hope that the local stakeholders would consider to integrate the values of Bisiru into their HIV/AIDS strategy and action plans. Lastly, we believe that oftentimes the solutions to our problems lie at the community level within the community themselves.